Hi, everyone, and welcome to today's webinar. We're talking about HIPAA risk assessments and mitigation. My name is Zachary Edgar, and my company is called Therapy Comply. I'm recording the webinar, and about 10 to 20 minutes after the presentation is finished, I'll send an email out to everyone, which will contain the link to the recording, and you'll be able to access this recording at any time. Just a disclaimer, the presentation is for informational purposes only, and none of the material is intended as legal advice. All right. Just a little bit about Therapy Comply. We're a compliance and education consulting firm specifically for physical, occupational, and speech therapy. We're web-based, so the web page has a bunch of guides, FAQs, policies and procedures on Medicare, TRICARE, HIPAA, billing compliance, all of that. We are working on all 50 states, so we're going to be adding PT, OT, SLP, FAQs and policies, Medicaid information, workers' comp, pediatric services, home health, medical records information, all that state law, including healthcare liens, waste, fraud, and abuse, all that. So please, go check out the website. I built it out for you, and I think it's really a great resource. So on the agenda today, we'll first talk about some of the basics of HIPAA, just some kind of important terms to be familiar with and information that's kind of key for understanding HIPAA, I think. I'll go into the latest enforcement actions so you get an idea of what the Department of Health and Human Services are looking for, what they're going after, and what people are getting in trouble these days. And then we'll talk about the security assessment, which is, I believe, kind of really the most difficult part of HIPAA. And we'll give you some tips on how to get through it and what it is and where you can get started. And then we'll talk about some strategies for mitigating those risk of breach and kind of what are the really important areas to look out for these days in terms of risk. All right, so the basics, first talk about what the big rules are. HIPAA is basically broken down into a privacy rule and a security rule. We'll talk about that. We'll talk about what's a covered entity, and importantly, that does HIPAA apply to you? It may not. And then what's a business associate, because that's a usual question that pops up. So privacy rule, that's outside of the scope of this webinar, but what it is this is the rule that it addresses the use and disclosures of your protected health information. So how you can use it in your practice, who you can disclose it to, whether it's to another healthcare provider, whether it's to the government, a third party, the patient, all that. So it's really governs all that. And most of this rule is kind of tailored up into your notice of privacy practices that you have to give patients. One important thing about this rule is that there's a very large proposed rule that changes many of the privacy many of the provisions of the privacy rule that was proposed in November 2020, and it's been basically in that position. The comment period was extended last March, but nothing has been done with that rule. It is a very large amount of changes, so just something to keep in mind that could change at any time, and I will be doing multiple webinars when that change occurs, if it does occur. The security rule, so this is a bit more of what we're going to be talking about today, though really just the beginning of the security rule, which is the risk assessment. Everything else is all these other standards, this is how you protect your information in-house. These are the policies and procedures you use to protect health information, how it's being created, transmitted, stored, all of that. So security standards, administrative safeguards, physical safeguards, technical safeguards, organizational requirements, and all those policies and procedures. So that's really the security rule. And again, this webinar is really about the risk assessment, which is that first part of the security rule. It's your first step when you do your risk assessment, and then after that risk assessment, you tailor your all these other standards really to your need, to the risk that you've identified in your assessment. So that's why it's such an important area. So covered entities. If you're looking through at HIPAA information, you often come up with this term covered entities. And what this is, covered entity is a healthcare provider, including all, therapists, everyone else, health plans and health clearinghouses, which is not something that's such a big use anymore, but they used to do a lot of claims management, things like that, handle those old transactions that HIPAA, the law, created. And So a lot of times you see the term covered entity. That's people who HIPAA applies to. And so who does it apply to? Well, it doesn't apply to all providers. It only applies to healthcare providers, plans that electronically transmit health information in connection with certain transaction. These transactions are claims, benefit eligibility inquiries, referral authorization requests. So if you are a therapist who's in a completely cash only business, you don't take any money from any plans, you don't do any inquiries, you don't file any claims, anything like that, HIPAA doesn't apply to you. But be careful, because if you're using EHR and things like that, that alone could actually trigger HIPAA, because some EHRs automatically transmit information to CMS and other things that can include those transactions. So you could unknowingly have HIPAA apply to you if you're using an EHR like that, if it's doing those automatic transmissions. So be careful in that regard. But again, if you're just a cash only business, HIPAA won't apply to you. But you do still have to worry about all those state healthcare record laws and things like that, which mirror HIPAA a lot in some ways. And also, if you look closely at your physical and occupational therapy professional conduct, you always have a duty of confidentiality and to maintain records to state law and federal law. So even if HIPAA doesn't directly apply to you through the HIPAA provisions, it may apply based on your professional codes of conduct. So those are things we just want to keep in mind. Okay. So another important thing, what is protected health information? And that's individually identifiable health information. It's information including demographic information about the individual's past, present, or future physical or mental health or condition, the provision of healthcare. So that's going to be treatment reminders, things like that. So if you're sending out treatment reminders, that's going to be protected health information, past, present, or future payment. So any payment information involved. And so it's not just the medical record, it's really everything involved, everything surrounding the treatment of that individual. And then anything that can, be used to identify the individual, a reasonable basis to believe it can be used to identify the individual. So it's quite a bit of information. And also, they have a list of identifiers. So these are things in the record that if you want to de-identify your healthcare records, you would have to remove all these things. So all these things are considered to be protected health information, as they can be used to identify a person. Of course, their name. You also have the address, and this address is not just their specific address. It's any subdivision that's smaller than a state. So that's, of course, a street address, a city, a county, and a zip code. So any of that information is considered to be like an address, even though, counties can be quite large. Mine is one of the largest in the country with 9.5 million people, but nonetheless, you can't have that information in there. Anything less than a state is considered an identifier. All elements of dates except for years. So you can have a year in there that would be the person's birth year, admission year, discharge year, things like that, which can be quite broad. But anything more exact than that, dates, months, that has to be removed as an identifier. And then also any exact age over 89. Telephone numbers, of course, fax numbers, less and less relevant. That person's email address, most definitely their social security number. Very important here. This is social security number, name and address. This is what, if you're getting hacked, if you're getting, what people want in your healthcare database is these numbers and this information, because this is what can be used to, steal a person's identity, open up a credit card in another person's name, all that. The reality is most, hackers, whatever it is, no one's really interested in someone's medical records. They're interested in this kind of information that can, be used to, for financial gains, illegal financial gains, and not for that healthcare information. So those are things you really want to make sure you're protecting. And it may be, may be wise, and I've advised us a number of times to just not even collect social security numbers if you don't have to, if it's not a requirement of the payer or anything else. That's just a piece of information, that just makes your records more attractive. Also, medical records number. So if you have specific medical record system that can be used to identify a person, you want to make sure you get rid of that. Of course, any health plan beneficiary number or Medicare number, something like that is that's an identifier. Medicare numbers are also extremely valuable to hackers, identity thieves, and such. So that's another thing you really want to protect. Any sort of account number you have there, a certificate or license number if you collect that for some reason from a patient, any sort of vehicle information. The web URL, I don't really understand how you would have that for a specific person. Same with an IP address. Though you may, for some reason, I don't know if you have a patient portal, if that would collect an IP address, but if it does, you want to make sure you don't have that. I don't know, finger point of voice print, you probably will never collect that. Photographic images, sometimes you may take photos of, a person's injury or a person's, something part of the evaluation maybe. You want to make sure that if you have those images, their face is not in them. And you also, if there's any identifier on that person in the image, like a tattoo or something like that, you want to make sure that you would get rid of that as well. So you wouldn't, and that would be how you de-identify a photographic image. And then any other characteristic that could uniquely identify an individual or give a reasonable basis to identify an individual. So it's really quite a broad list, and this is all of what you are responsible for protecting, not just the actual medical records themselves. Now, ePHI, so you'll see this a lot. This is electronic protected health information, and it's all that information I just talked about, and that is going to be transmitted by any electronic media or maintained in an electronic media. So if you're creating if you're creating that information on a computer, if you're storing it in the cloud or on a hard drive, anything like that, that makes it ePHI. And that's really what you are protecting with the security rule is designed in a big part is to protect this ePHI, the transmission of this protected information electronically. And then finally, business associate. So a lot of people always ask questions about who is a business associate, and that is going to be a person or entity that performs certain functions or activities that involve the use and disclosure of PHI. This is going to be someone who's not another healthcare provider. And an important note here, if you have contract providers, a contract therapist, or contract assistant, whoever that works for you, they're not a business associate. They're going to be considered an employee as far as HIPAA is concerned. They're your employee. A business associate is someone who is not a healthcare practitioner who is doing other work for you. So a third-party administrator that helps with claim processing, a CPA firm that may have that may need protected health information to do its job, an attorney whose legal services involve access to health information, a consultant that performs utilization review, anything like that. So anyone who's kind of outside the healthcare realm, but they need to use your protected health information, they're a business associate. And in that regard, you need to have a business associate agreement with them. And that requires them to, actually adopt that security rule and all those provisions and protect the PHI as you would. And it is important you need to have a business associate agreement. This one here, this is just 2015. So the Center of Children's Digestive Health, following an initial investigation of the business associate, which was Filefax, and Filefax stores records, healthcare records. They also dispose of it. When they, were looking through Filefax's record, they found that they found healthcare records from the Center of Children's Digestive Health, but did not find a business associate agreement on file. So Center of Children's Digestive Health was fined $50,000 for that. So not having a business associate agreement can be very expensive. and business associate agreements. They should just be, regularly done. It's also important these days to have one if you're using email services to transmit PHI. A lot of the companies, Google, Microsoft, other companies that do email, things like that, will do a business associate agreement with you. If they do not, if a company will not do a business associate agreement with you, then you should not use that company in their services to transmit any PHI or store any PHI on them. So that's just a very clear indicator there. All right, so now into latest actions. And another note, if you have any questions during the webinar, I know this is pretty, can get pretty detailed and I go pretty quickly. Feel free to email me after the webinar. I can't, because of the high number of people who have joined, I can't answer it during the webinar, but if you have any questions, anything pops up, send me an email, and kind of what I'm hoping to do by tomorrow or on the weekend is put a list together of all the questions and answers and send them out to everyone. I think that will be pretty helpful. So don't hesitate if you have a question to send me an email. My email is always open. Anyways, so to latest actions, this one's a pretty important thing. This is what HHS has been doing lately. For the past couple of years, they've been pretty much on hold, but they have been doing this. This is the Right of Access Initiative. And so the rule for HIPAA, for a HIPAA covered entity, healthcare providers, you have 30 days to provide a patient, an individual, or their representative with their healthcare records. So right now the rule is 30 days. There can be a 60-day extension. In the proposed rule, you're going to have to return that health information within 15 days. But anyways, you had 30 days to do that after a request. If you don't do that, a patient can file first you'll be breaking state law, but you'll also be breaking HIPAA. And a patient can file a complaint with HIPAA, with HHS, and these are the fines for it. These are one patient. So advanced spine and pain management, one patient didn't get their medical records on time, $32,000 fine. Denver Retina Care, another $30,000 fine for one patient. And these are just a few examples. They're counting them down. They do a lot of these. So these are very significant fines. So if you are having any problems getting information to your patient in a timely manner, it's really important to figure out why you're having problems with that and to fix them as soon as possible. Another big risk here is what just happened to Rain Rock Treatment Centers, is they had this complaint done, and then HHS decided to kind of look more deeply into the practice and found that they were missing the required policies and procedures. So HIPAA does require you to actually have HIPAA policies and procedures on file at your location, and what those were missing, combined with the right of access fine, was $160,000 fine. So of course, very, very painful for even a medium, even possibly a large size practice. So be very cognizant of of how you are handling protected health information when it comes to patient requests. Another example, and some of these, you'll see that I say latest, but some of these are dated, January 2015, and that is because these investigations actually take quite a bit of time. And that is not pleasant time when you have the federal government issuing subpoenas, interviewing your staff, things like that, going through your files. They take a long time, and it is very painful. So, it's just more of a reason to avoid getting into trouble. Peach State Health Management. So they were doing some management services for the VA's telehealth program in 2015. They were a business associate. They're actually kind of considered to be a hybrid entity where they have a healthcare. They're a healthcare provider, but they also provide other services to other healthcare providers. And so what they failed to conduct an accurate and thorough assessment. potential risks. Peach State failed to implement security measures sufficient to reduce risks and vulnerabilities to a reasonable and appropriate level. They failed to implement any sort of hardware or software protections and all that, and then also failed to maintain. And they agreed to pay to HHS 25,000. Actually, sorry, that's a typo. It's 250,000. So uh, so it was quite a bit, pretty hefty fine for basically failing to follow the security rule, not doing the risk assessment and not maintaining those policies and procedures. Athens Orthopedic Clinic. So Athens Orthopedic Clinic was hacked. There was a group called the Dark Overlord, and it was determined through computer forensic analysis that Dark Overlord obtained a vendor credentials to AOC's system and used them to gain access in 2016. Well, the AOC terminated those compromised credentials. They were still able to access. They were not effectively blocked. That was probably because they did not have effective audit systems and things in place to check who is accessing and why, when, how. The breach determined that 208,000 individuals were affected by that breach, and the number of people affected by the breach is a big part of the fine. So the more people, of course, who are affected by a breach, the higher the fine is going to be. And that breach exposed protected health information, including names, dates, social security numbers, all that, and that all together that amounted to a $1.5 million fine. So even though this clinic was maliciously hacked, not having the proper protections in place, they were fined for it. So even something that's an intentional hack against you, you're still responsible to protect against that. And if you don't do that correctly, you will be fined. Lifespan. So the lifespan, what happened here was a hospital. It's a hospital system. An employee's car was broken into, and a Mac laptop was stolen, and on that laptop was contained a whole bunch of PHI. So having that was stolen, even though probably the person who stole the laptop had no interest in the information on there, that's still considered a massive breach. And the analysis revealed that the laptop was not properly protected, and that the person who stole the laptop could gain access to it. And to properly protect something remote, and we'll talk about this a lot, there's important way to do that is first is to have a password protection when you open up the laptop or tablet. So you open it up, you need a password to get in, and then another password when you want to access EHR or your cloud system, anything that contains PHI, you need another password to that. Another important protection for this is to have remote wipe capabilities. A lot of Microsoft will let you do that. Apple will let you do that. You can download software pretty easily that will allow you to do remote wipe. So having those capabilities combined with those passwords would protect you from having a device stolen from a car or from however it would be stolen. So if you don't have those protections in place, something is stolen, HHS is going to consider that a massive breach and hold you responsible. So that's very important to have all of that protected. So looking at their policies and procedures, they did not have policies and procedures to encrypt all devices. That means password protect. They did not have a policies and procedure to track or inventory all their devices, and we'll talk about that as part of the security assessment. And LifeDen did not have the proper business associate agreements with their other corporations, things like that, their other affiliates that were doing business associate work for them. And that disclosure, even though probably no one saw the information of 20,000 people, that was $1 million fine. So, very important to make sure that if you do have, remote devices, laptops, tablets out and about there, if your employees can take them out of the building, if they are, visiting patients in their home, anything like that, is to have proper protection over your systems. All right, so now into the risk assessment. So now this, like I said, this is the first stage really doing HIPAA and the first stage of the security rule. And the requirement here, a part of the security management process, is to do the risk analysis, conduct an accurate, thorough assessment of the potential risk and vulnerabilities to the confidentiality, integrity, and availability of ePHI that's held by the provider, and risk management to implement security measures sufficient to reduce risk and vulnerabilities to a reasonable and appropriate level. So those are what the rules look like. And what you get, in over all these, this is a 20-year-old rule. Over the years, HHS has released a lot of guidance on how to follow these rules, and that's where you get really the meat of it. So just some important definitions first. So risk is the potential impact that a threat can have on the confidentiality, integrity, and availability of ePHI by exploiting a vulnerability. Threats are anything that can have a negative impact on ePHI. These can be intentional, something malicious, like a hacker or disgruntled employee that wants to delete things, anything like that. And then there's also unintentional threats that can be a misconfigured server, something a data entry error, accidental deletion, things like that can be unintentional. And so you'll look at, and for a lot of this, you'll look at your EHR program and see what are the ways we can avoid unintentional problems. What's the backup like? Are there warnings in your EHR against faulty deletions, data errors, things like that? Also threat sources, so there can be natural floods, earthquakes, storms, tornadoes, and this is an important part of your risk assessment. Those natural disasters can be bad. So if you are in the Houston area or in Florida, the southeast coastline where you get hit by a lot of hurricanes, if your practices can be at risk for flooding, damaging a server that's on site or damaging systems, hard copies on site, what are you doing to protect those things from that flood damage, from that risk there? Do you have things backed up in the cloud? Do you have proper security, proper storage mechanisms to reduce the risk of damage to that on site if you get hit by these things? So that is something you need to address. If your area is prone to natural disasters, you need to address how your systems protect against that. Human, this is a huge part too. So this can be intentional, identity thieves, hackers, spyware, and then again, the unintentional mistakes that can be made. Those are the human threats. And then environmental, these are in there, but they're not such a big deal. You can have power surges and spikes that may break a server, may break a laptop, something like that. So what are you doing to do that? Usually that can be a surge protector, things like that will protect it. There can be, issues if you have servers on site. You want to make sure your IT person, whoever installed those servers, has good protections there, and you want to document that. So what the protections you have with on site there, and that's important too. If you have an IT person who may not be a permanent IT person, someone you just hire to do this for you, that person should be really involved in your security risk assessment. They're going to have a lot of insight when it comes to your IT about this. So it's a good idea, to have them sit down when you do a security risk assessment, to have them there with you and to go over a lot of these things and, talk to them about what they've done to protect your system and all that, and to document that. So that's really important there. Even if it costs, the person's time, even if it costs some money to get that person to sit down with you, it's very worth it. You should, unless you're an IT specialist yourself, you shouldn't guess at these things. In vulnerabilities, there can be a flaw or weakness in a system, security procedure, design, implementation, or control that could be intentionally or unintentionally exercised by a threat. And then impact is the negative quantitative and qualitative assessment of a vulnerability being exercised on that confidentiality and integrity of your ePHI. So there is a security risk assessment tool. So this is a free tool that HHS or healthit.gov has released. They do update it yearly. It is a pretty involved tool. It's pretty antiquated, but it does work. and it is a good tool to use. I know there are a lot of private software companies out there that are creating their own tools. You can use them, but if you want to go a cheap, free but effective route. And it is an effective route if you really do spend the time and you go through there, step by step and do it. It's more than adequate to cover your to do the security risk assessment. So it's available there. There's also a lot of instructions. There's webinars on how to use it. I also recommend if you're doing a risk assessment for the first time, or if you're expanding something like that and you're doing a whole one, do your security risk assessment, but hire someone like me, or someone else who is, who knows how to do a security risk assessment and can help you guide you through the steps and answer questions like that. That can be a really big help. My approach to compliance is, and I believe, that it's very important for a healthcare practice, whether they're one person or a large practice, medium-sized practice, large practice, to know, to have a good grasp of compliance and what's required of them, and to, really be involved with their compliance procedures. Now, you can easily, anyone will. I see there's a question. I'll do my best to answer it. When obtaining health insurance information from a patient, is it against HIPAA policy to obtain a text of the patient's card? It's, HIPAA really hasn't addressed that when it comes to text messaging. They don't like it. Because there's no, there isn't really a lot of security when it comes to cell phones. You do have, a lot of times you'll have one layer of security, one password to get in your phone, but that's really not enough when it comes to HIPAA. So, texting patients back and forth really isn't HIPAA compliant. My advice, if you do that, I know a lot of patients want that, to get something in writing for the patient to acknowledge that they accept that risk. But in general, really text message is not HIPAA compliant, even though it is encrypted. If your phone gets stolen, something like that, you have all that information just in your text. That's just not enough protection to be HIPAA compliant. So I do not recommend having patients text information to you like that. There should be another way to do that. You can collect that in person, or have it done through more secure email, and we'll talk about that towards the end. But I do, going back to the security and compliance in general, it's very easy for you to download policies and procedures, and I have a package on my website of policies and procedures that you can download, and guides too, and that you can always do that, but it's very important that do these policies and procedures conform to your practice? Are they tailored to you, or are they just generic? And you can also purchase a generic security risk assessment, but that's not but you would be outside the law there as well, because HIPAA, HIPAA requires you to do it, and to be done based on your own practice's risks, and to also tailor those policies and procedures to your practice. So it is a good idea to really understand these rules, and to have, you can definitely have someone guide you through, have some help, but it is important to do this on your own and to understand it. And in doing that, you'll be, not only will you be following the law, but it will help you throughout your practice to follow the law better. When it comes to, problems arise, you'll be better able to handle them, if you have a good grasp of the law, rather if you are, completely dependent on a third person. So just keep that in mind as I go through. So a risk assessment steps. The first is scope of the assessment, and part of that, again, that goes into gather the information, identify realistic threats, identify potential vulnerabilities in your system, assess the current security controls that your system has to mitigate those threats and vulnerabilities, determine the likelihood and impact of those threats, determine the level of risk of that, and recommend security controls if your current security controls are not adequate, and then to document all of those risks, that document everything. Everything needs to be documented, and that's another thing that security tool helps you with, is it documents everything as you go along. So the scope of your assessment, so this is basically, it is your entire practice. It's, you're going to be identifying where ePHI is created, where it's received, where it's maintained, processed, or transmitted. The scope of the risk assessment should include both the physical boundaries, so that's your location, what are your security, how is things secure at your location, and then also the electronic boundary of how how this ePHI is being created electronically, how it's being transmitted, stored, and all of that. So everything you need to keep in mind all of that. So ensure the risk assessment scope takes consideration if you have remote and portable devices. So if you've had any laptops, removable media, that's going to be a removable hard drive, something like that, where your backup is, any sort of tablet, anything that has access to your system, any device that creates it, you're going to want to list all of that out. That's all within your scope. You're going to identify all of those devices and all the protection on those devices, who has access to those devices, and everything like that. So that's part of the gather information. It's once you determined, the entire scope of everything, you're going to gather all of it. So how is your thing created, received, maintained, processed, transmitted by the provider, and what are those security controls? So just some questions. Who is creating your PHI, your assistants, therapist, whoever it is, who is creating your notes, creating the evals, creating the PHI? That's also your front desk people who are putting the information about the uh, health plan numbers, name, addresses, all that. That's all PHI. So that's who is creating it. And then how, so are you are you writing it down, or are you immediately putting it into a EHR, or typing it up on a computer and then putting it in EHR? That can also create a vulnerability. If you are typing something up in, say, Word, and then uploading that into an EHR, that Word file is not going to be as protected as what it would be in the EHR. So just keep those things in mind. Where and how is PHI stored? Is it being stored in the cloud through your EHR? Are you storing it in a hard drive on site? Something like that. So how is it being stored? Who has access to that storage? Is it vulnerable to natural disaster, or is it vulnerable to power outages, whatever it can be? How is PHI being transmitted? So are you transmitting it when you have the EHR? Is it all in one contained system, or are you transmitting it through a number of ways, which can again lead to more vulnerabilities? Also, how are you transmitting information between providers, between patients? As we just talked about, text messaging. A lot of patients want to transmit information by text. That's just not HIPAA compliant. So it's a good idea to tell them, no, we need to find out other alternatives. Also, how is it being transmitted through to other healthcare providers? If you have if physician gives you a referral, that is a transmission. If you give any information back to that physician, you're transmitting it. So how are you doing that? Are you doing that by email? Is that email secure? Are you sharing EHR links? That's all things you need to document and consider. And then who can access that PHI? So are you making sure that people who don't need access to the PHI have it? Why? Who has it? Your therapist, your assistants, they're going to need to have access to patient records, but maybe make sure that the night janitor has no way to access that information, whether it's stored hard at the system or electronically. Make sure that any employees who have been terminated or who have quit, whoever like that, you've revoked their access. So all that. Identify realistic threats. So the goal is here is to identify the potential threat sources, and we talked about those the natural threats, the human threats, your biggest threats today. When we talked through these, natural disasters, but your biggest threats today are going to be those intentional threats from malicious hackers, things like that, malicious software, phishing scams, all that, but also the unintentional ones, the data entry errors, the accidental deletions, all that. So how do your systems protect against that? And then those environmental ones, this is a typo again, but like I said, the environmental ones, hazmat contamination, things like that really aren't a big issue with therapy practices. So you're going to also identify your potential vulnerabilities. So this is how, weaknesses in your system that can be exploited. Of course, the more, so for an example here is the laptop that was stolen by the car. The threat is a person who's stealing laptops from cars. The vulnerability is that vulnerability is your laptop is in a car. It's vulnerable to being stolen. If laptops are not being left in cars, that greatly reduces the vulnerability. If you are not having, if you don't allow PHI laptops, tablets to leave your office. That also reduces the vulnerabilities. The more you allow people to take things out and about with them, that increases the vulnerabilities of being stolen. Also, I'll talk about this, when people go to your local Starbucks or any kind of thing that has public Wi-Fi, that's a big vulnerability. Very open. It really opens up to any sort of hack that can easily be done by someone else who's on that Wi-Fi. So those are just potential vulnerabilities there that can be exploited. Providers should use internal and external sources to identify potential vulnerabilities. So these are some suggestions from HHS themselves. The National Vulnerability Database it does not help you. It's basically a long, constantly updated list of security little software vulnerabilities for all the software that's used in the US. Just a massive list that's just unreadable for people who are not in this system. But an important one is these HIPAA for professionals, their cybersecurity page. So they release newsletters basically every quarter. They also have good information about cybersecurity, things like that. So that's a good resource, and they will keep they will talk about on there. You can find information about how hackers are latest attacks on healthcare institutions, on practices, things like that. So how people are doing it and steps to mitigate that. So that's definitely an important resource to use, and that can, going through that resource can definitely help you kind of identify your own threats and vulnerabilities there. So that's something to definitely to spend some time on to check out. Assess current security controls. So you're going to think about what you already have in place. Do you have antivirus software on all these devices? What are your password controls? Do you have strong password? You require strong passwords. That is, passwords are the key to protecting your PHI. Having strong passwords when opening up the laptop, when accessing HR, that is very important to protecting your information. And I'll talk more about passwords, but I think that they are, they're very, very important. And that is how people gain access to your systems usually. A lot of people like to think about hacking as someone going on, typing in a bunch of code, going through some backdoor vulnerability in a system. Yes, that can happen, but the most frequent case of vulnerability is a hacker guesses a password. Because a lot of people still use password as their password 1 2 3 4, or basic information, their name, something like that as the password. So you have to make sure that your staff are not doing that, either by requiring strong passwords in your policies and procedures, and also making sure that the software you use requires strong passwords. So you need to do both of that, and that will definitely help your security controls. But again, another thing you're going to do, I think it's really important too, is to look at, go through your EHR program and to understand the security controls that are on your EHR already. They should, if it's a HIPAA compliant EHR, which is absolutely what you should be using, they're going to address a lot of this as well. So your EHR program is going to do a lot of the lifting for you, and you should understand how they do that. So just more into this, providers should evaluate the technical and non-technical security controls at all places where ePHI is created, received, maintained, processed, transmitted. The evaluation should determine whether your security measures are strong enough and adequate to protect that. and whether the measures that are required by the security rule are in place and configured for your practice, and the appropriateness and adequacy of those security measures. So that can depend, of course, on your size. A large hospital system is going to have security on site. They're going to have cameras. More, that's going to be more expected for a large system. If you're a solo, small practice, you're not expected to have a security guard on site, to have it covered in cameras, but you are still expected to, have adequate controls that are appropriate for your size. So that is always going to be important there. The likelihood and impact of the threat. So gauging likelihood, big part of that is going to that cybersecurity newsletter. How are people hacking? What is more the likelihood of that? If you have a place, if your practice is in a place with a large amount of break-ins, that's going to be, that's something you need to address. It's something you need to, label down and address, what you do to prevent things being stolen if there's a break-in. Part of that too is with natural disasters. If you live in a place with, who has frequent or yearly natural disasters, you need to address the impact of that threat. I live in Phoenix, Arizona. We just don't have natural disasters. That's great, but so practitioners in Arizona don't have to address, dealing with hurricanes or earthquakes. Practitioners in Houston, Florida, South Carolina, they do have to address, how you protect your PHI, your ePHI in case of a natural disaster. Likewise, California, you have to address, what happens, in case of a earthquake and what protections you have in place if an earthquake happens. So those are things that can likelihood and impact of threat. They just have to be realistic to your practice. This is just kind of more on that. Things like, but a lot of this is kind of more, I think, too much HHS dribble, to be honest. I think it needs to be better adapted. But anyways, determine the level of risk. So again, that's going to be part of, and and you've seen a lot of this overlaps. So these steps overlap. Determining the impact, determining the level of risk is really going to be the same process. And the level of risk is, is this a high risk or a low risk? You have a much higher risk now from, hackers, much lower risk from hazmat contamination, things like that. So your level of risk is just going to depend on, where things are more frequently happening, and things like that. So again, check that cybersecurity, those newsletters, to know what the level of risk is. And you're also going to have, another, important thing is when you have antivirus software on your computer, on your tablets, whatever it is, and you should always have antivirus software on everything you have, you're going to want to, and that antivirus software will notify you if there's been an attempted hack. They'll notify you if they've encountered an email with a virus in it, and it's a good idea to keep track of that in those audit logs as part of your security assessment and address that. So that use that antivirus software to your advantage in that way as well. Recommend security controls. So if you've determined there are security controls that are lacking, whether you have, you've seen you have weak passwords, if you have systems that are lacking, that don't have the antivirus software involved and installed, all that. So those are going to be the security controls that you're going to recommend. Another part of recommendations, having that IT specialist on site, to help you through this, or having a, compliance expert on site to help you, recommend new security controls, things like that. So that can help you as well, or recommend things specific for your practice. So once you've identified your weaknesses, looking out there for solutions, what helps you with these vulnerabilities, that can all help. And then you're going to also determine ones with, cost benefit analysis, what's, justifiable, what's not, of course. So you're definitely going to be, cost benefit analysis, paying the yearly, $90 a year for antivirus software that covers, 3 devices or more. That's going to be, that's definitely going to be a benefit that outweighs its cost. It may not be a cost benefit. You may not have that benefit to hire a security guard to be on your premises 24/7. So those are the those are the cost benefit analysis things you should think about. Depending on the size, what is justifiable there and what you need to do and what's not justifiable. And then you're going to document all this. So again, like I said, that the program from the health IT that helps you document all this stuff, and you're going to maintain all this documentation for at least 6 years. So that's the HIPAA requirement. Any policies and procedures you do, anything related to HIPAA, you're going to maintain that for 6 years on site, on the cloud, however you maintain information. You're going to want to do that. So you're going to want to have all of this documented out there. You're going to have all your vulnerabilities identified, risk assessed, security control recommended, all that, step by step there. And again, that healthit.gov, that program will help you do all this. Okay, so a little bit more about mitigation of risk, and I think these are some of the more important areas. So cybersecurity, make sure you have antivirus software installed, also remote wipe capabilities on all your devices that are used to create and maintain PHI. Make sure your software is being updated regularly. Software updates often, they patch security holes, things like that. So if you do, you want to make sure your antivirus software is being updated automatically. Your EHR software is updated automatically. Same with drivers, Windows updates, all that. You want to make sure everything is being updated when it's required to do so. Use only secure Wi-Fi, so have Wi-Fi on your premises that's secured, that needs to be accessed through a password. Do not, go to Starbucks or McDonald's or wherever else, the bar, wherever else it is, and access their Wi-Fi with a device that has PHI on it. And also, do not work on your documentation at the Starbucks with that weak Wi-Fi. If you need to do that, use a VPN. Those can be installed and downloaded and installed. They can also usually antivirus software will also usually sell you a VPN as an extra perk. Reduce risks like third-party apps, other apps, other software that you may install on the computer. If you have computer tablets, what have you, that's dedicated to your practice, don't let people go home and install whatever they want on it. Make sure that anything that's being installed is just related to your practice. Phishing, so these are going to be those unsolicited third party, usually through email. Most of these, how I've seen them, they look like an email with like an invoice attached, or something, with an attachment from a company you've never heard of, from a healthcare provider you've never heard of. So if someone sends you an email with an attachment, if you've never heard of them before, if you're not expecting an invoice, don't open it. If you're using Outlook or anything like that, you should be able to scan the email with an antivirus software. So scan the email. Be wary of clicking any links or anything that with those messages as well. And you're going to look for something, it's generally going to be fake websites, mimic real websites, anything like that. So just kind of pay attention, just kind of double look at, any email addresses coming through, anything that's not a .com, .org, .edu, be wary of. Definitely no .ru or kind of anything that's, just to say, usually coming from outside of the US, because that's where a lot of hacking comes from. So just take a look at that .com, all that to see if it's good there too. Ransomware. So ransomware, it's a malicious software hacking, and this can usually be, what it does is it takes over your device, and it won't let you access the device or information on the device until you've paid them Bitcoins usually. How you protect against that, again, update your software operating systems, make sure you have strong antivirus software, don't click on links or open attachments, and back up on a regular basis. If someone has compromised a laptop, if all that information is backed up regularly to your EHR, to your cloud, then that's protected, and you don't have to worry about ransomware. But it's better to protect it up front by using good antivirus software and good password management and things like that. Also, restrict users' permission to install and run software that's not going to be, part of your practice. That's not in there. Application whitelisting, so only approved programs. Enable strong spam filters to prevent phishing emails, though that can be easier said than done. And then scan all incoming and outgoing emails. So again, most virus software will do that for you automatically. Will scan incoming and outgoing emails and make sure that whatever email system you're using allows them to do that, and configure firewalls to block access to malicious IP. Again, that's going to be something your antivirus software will do for you. I really cannot stress enough how important antivirus software is and all that. Again, cybersecurity newsletters, the link is here. This is a great resource for that kind of information. And email. So use secure email. Free internet-based email services shouldn't be used, even though they are encrypted. You should use those secure emails. You want to also, again, when you have it, use a system, a company that will sign a business associate agreement with you. That is required. If you are sending email, patients' emails or another provider email, PHI through email, make sure you verify the email address before sending PHI. So just double check to say, hey, before I send you, your healthcare records, I just want to make sure it's you. So send that before. Have a fully secure alternative for patients. So now patient portals, things like that, you can set that up pretty easily and pretty cheaply, and that will enable a patient to go on, create their own username and password so they can access that information. You can also use those portals to transmit PHI through other providers. So those are definitely very good alternatives. Inform your patient if your patients are using Google, Hotmail, Yahoo, things like that, which most likely they are. Inform them that their client may not be their email client may not be secure. So give them that in writing before you send that, just to get extra permission to send that along. Make sure your access to your email account is secure with a strong password. And note with passwords too. I would suggest having your people update passwords once every quarter to 6 months. Don't do it more frequently. Don't require monthly. That usually people, when they have to do it monthly, usually end up writing their passwords down or making only simple changes. You want strong passwords with uppercase, lowercase, numerals, and symbols. So something that is strong. You want to make sure that you're configuring any kind of software you have to require that. And you want to, talk with your employees about strong passwords, because that is how most things are hacked, is weak passwords. Also, we all have our disclaimers on our emails that about PHI and about if you get this, if you got something in error, da 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 da. That is it's what we call sufficient. That is necessary but not sufficient. So it's you need to have it, but it's actually not a legal barrier. If you had that on your email, that disclaimer about PHI, and you send the PHI to the wrong person, that is a breach, no matter what your disclaimer has. So even if you had that disclaimer, and you should, it is not a barrier to a breach. So it's kind of a weird system where you need to have it, but at the same time, it does not protect you from a breach if you send a wrong email. So make sure to double check a person's email address before sending any sort of PHI through email. Encryption. So this is, the security rule was written 20 years ago, and they had no idea what encryption was. So they just said everything needs to be encrypted. Everything is encrypted today. Email, text messaging, everything is encrypted, but it may still not be enough. They do require those business associate agreements with companies. So even if a company, Google, is encrypted, which they are, you still need that business associate agreement. But part of the encryption is you want to make sure PHI is in the body of the text and not in the subject line, which is not encrypted. So you just want to make sure everything is protected. But again, there's no such thing as unencrypted email anymore. This is kind of older HHS information. But again, alternative Patient portals, these are, a good option. They're becoming cheaper and cheaper to set up. Encrypted email services. Zixmail is kind of an old one. It was kind of the first one to do this and be HIPAA compliant. Now a lot of companies are doing HIPAA compliant email. It's also a lot cheaper than it used to be. You can get a free email address, but Zixmail is charging you, $600 a month. That was outrageous. So you can get that now a lot cheaper. Just again, make sure you have a business associate agreement in place with your email provider. Mobile devices. So again, mobile devices really do increase your risks a lot. Having things out about in the world, you increase the risk for getting something lost, something stolen, inadvertently downloading virus or malware. If you're using unsecure Wi-Fi, or if your kid at home is playing around on your device and installs something. There's also that risk too, is unintentional disclosure with friends, family. If you're using a device for personal and professional reasons. Unsecured Wi-Fi as well. Those are all risks with mobile devices. So if you are allowing mobile device use in your practice, make sure you're addressing that in your security risk assessment of what you do to protect that when those devices are out and about in the world. All right, well, that basically wraps everything up. I know it's a tremendous amount of information. That's why my email address and my email is always there. My website, Therapy Comply, I have a lot of this information, guides and policies and procedures, all on HIPAA, Medicare, TRICARE, state information. Please, please, please visit the website. Consider joining. The more members I have, the more I can deliver these services to you. And keep everything up to date and accurate. So please visit. I made this website for you. Please consider joining. I also provide consulting services. So if you do need help with a security risk assessment, or really anything in that, in the compliance field, please take a look at the services I provide. And there's also, benefits for being a member there as well. Anyways, if you need continuing education credit, I need your full name, your license number, your state, and your profession. Send that to me in an email. I'll also send that list as a reminder. It does take about 20 minutes for the recording to process. So in 20 minutes or so, I'll send out an email with all that information again. So you can respond to that email with your information. And I'm going to do and I have a lot of people from today and tomorrow, so I'm going to do my best to get all these certificates out by the weekend, but we'll see how that goes. But that is, so if you don't get anything today, give me a little time. I do have, about 200 people all together, so I'm going to try my best to do that throughout the weekend. All right. Anyways, I want to thank everyone for joining me today. And again, email me if you have any questions, and have a wonderful rest of your day.